At Anatomy, we know that you're going through a very tough time at the moment, and our most sincere and respectful thoughts go out to you and your family if you've been affected by this dreadful virus. Our government has recognised that physiotherapists are essential key workers, and when you've got a lot of pain and don't want to bother the GP or can't get an appointment to see the GP and you don't want to go to accident emergency, we understand. We are here for you. At Anatomy, we have always taken your health and safety very seriously, but now we've taken extra steps and measures to keep you safe within our clinic. At the moment, 90% of our patients are happy using our new telehealth service using Skype, Zoom or FaceTime. We can still conduct a consultation and an examination with you, and where necessary give you extra exercises to help you. You'll be astonished at what we can achieve using this new service, and already we have the most amazing results. However, if we feel you've got to come in as you're in such desperate pain, or we feel you may have something more serious which requires a more thorough examination or treatment, we have taken extra steps to ensure where possible you are seen within a safe environment. We have based this on the latest evidence-based research and guidance from Public Health England. This simple process will be explained to you further when we triage you before you come in. Some of these points, however, can include a phone triage just to ensure that we feel that you're safe and not vulnerable and make sure you fulfil our safety guidelines. Operate a strict social distancing rule within our clinic so you come into minimal contact with anyone but your designated physiotherapist. And again, this will be explained to you before you come in. We will do a quick health check on you before you enter the clinic, which includes infrared non-contact temperature and measurement of oxygen saturation levels. Even though this does not confirm you've got COVID, it's there to minimise risk. You'll be taken through some aseptic cleaning procedures also before you enter the clinic. And we'll also be offering you some personal protective equipment for yourself, such as masks, visors and gloves before your consult to make you feel more safe. You will also be escorted from the room to the room to minimise contact to anyone else, and our physiotherapist will be wearing full personal protective equipment, medical grade face masks, visors, sleeves, aprons and gloves, and this is there simply to protect you. And even though we can do treatment on you, some of the procedures and equipment have been withdrawn for your safety, as we think they may be too risky. Before you leave us also, you'll be escorted out and ensure that you go through the same aseptic cleaning procedures and social distancing. Other things that we're doing is a simple medical checkup on all our staff when they arrive at the clinic, just to ensure that we don't think they've got any symptoms. We've also reduced the overall staffing within the clinic, again to help with the social distancing and making sure you come into minimal contact with anybody. Our clinic now operates also a very deep cleaning program each day and throughout the day, including common touch points. All unnecessary equipment has been removed from the clinic to avoid clutter and cross-contamination. And all the equipment we use is cleaned thoroughly after every session using very advanced cleaning agents, and also the use of ultraviolet light, which we know can kill off the virus. These are just some of the steps we are taking to try and keep you safe, and this will be reviewed on a regular basis to ensure we are always, where possible, one step ahead. We know if you've got to come in, our responsibility is to absolutely minimise any risk to you, and we would only bring you in if we thought it was really necessary. So if you're in pain, don't wait. Call us now. We've got so many options to give you.